So my name is Britta Hanssen. I'm a postdoctoral researcher who works on clinical study 4, the FOSTER study, where we collect longitudinal prospective observational data of stroke patients in the rehabilitation phase. For me, the most exciting part is that we're gathering a new data set, a longitudinal, quite extended data set that combines both clinical assessments and biomechanical assessments, and it has a very strong patient-facing component, but at the same time we're then contributing to the larger project. So the combination of those two is what makes it very exciting for me. So the clinical study 4 provides longitudinal follow-up data of functional ability of patients after they had a stroke, and by that it provides data for the validation of the virtual twins or the prediction models that will be developed in the overall project. So it's largely meant as a validation data set for the models that are developed beforehand. I hope to see that rehabilitation can become even more personalized by improving our assessments as well as by improving our rehabilitation plans. So really establishing where is the patient now, but also knowing this patient with these characteristics will have this trajectory potentially or probably. So if we intervene with this intervention aiming at these goals, then we can help them or improve them more personalized than we are doing at this moment, where it's more general applied and it's often a lot of clinical knowledge that's not very scientific based. So why did I apply for the job? Because it was, for me, a new type of project. The idea of gathering this quite unique data set, the longitudinal aspect, very extensive data set of stroke patients in the rehabilitation phase, but also the combination of having the clinical skills that are now used in the clinic, in the hospital, in the field, but also to apply some more technical aspects to that, so working with sensors and providing a game-based environment. So the fact that it's linked to what we are doing now in clinical practice, but also bringing a lot of new aspects to that is why I applied.